Today, the top Republican in the House, John Boehner, took aim at President Obama's 11 pages of proposed fixes to the health reform bill by slamming the president's proposal as being too short. A spokesperson for Mr. Boehner said, quote, "The White House's plan consists of an 11-page outline. So they want to reorganize 1/6 of the United States economy with a document shorter than a comic book." The little hairs on the back of your neck are standing up right now. It might be because the accusation that the health reform plan is too short is sort of weird enough on its own, but it's really weird coming from John Boehner, since John Boehner has been the guy telling us for months now that the health reform plan is too long.
1,990 pages. Now tell me how we're going to fix our healthcare system with 1,990 pages of bureaucracy.
Speaker Pelosi's 1,990-page bill is going to raise the cost of health insurance.
The best way to get a sense of what Speaker Pelosi's takeover of healthcare looks like is to actually look at it. Just shy of 2,000 pages, it runs more than 620 pages longer than the government-run plan Hillary Clinton proposed in 1993.
The best way to get a sense of this bill, he says, is just to look at it, the size of it. All 1,990 pages of it. See, what's on those pages doesn't matter. The horrible truth is just how many pages there are. This has not just been a rogue John Boehner complaint, though. This has been a tried and true Republican Party talking point all along.
The bill that we apparently will vote on later this week is 1,990 pages of bureaucratic gobbledygook.
This bill that's before us, these 2,000 pages, do affect us from conception to natural death because it funds abortion and it has death panels.
Mr. Speaker, I know you and so many others have been spending their weekends reading this 1,990-page monstrosity.
We're here today in opposition to Speaker Pelosi's 1,990-page government takeover of health care. I can tell you it's a lot of pages. It's about 20 pounds I'm holding up here.
This is the Pelosi health care bill. 1,990 pages. Nobody in this place has even come close to reading it.
That was then. Health reform is just too long. Now, John Boehner, top House Republican, says that health reform is just too short. It is beginning to feel like John Boehner's vehement opposition to health reform is only being outdone by John Boehner's vehement opposition to John Boehner. For example, this bipartisan health reform summit at the White House on Thursday is something that John Boehner #1 sort of demanded.
There has been no attempt, not one attempt, by the administration or the Democrats in Congress to actually sit down and work with us.
Okay. John Boehner #1. You've asked for some type of summit. Now you've got it. Other John Boehner, what do you think?
I don't want to walk into to some setup. I don't know who's going to be there. I don't know how big the room's going to be. I don't know what the setup's going to be.
Oh, smackdown! Take that, John Boehner #1! Then there's the issue of secrecy. John Boehner #1 has been calling for full transparency in these negotiations. Let the cameras in.
The president, during the campaign last year, said that when we got to this part of the process, that it'd be a big open room, and he'd invite the C-SPAN cameras in so the American people could see how this bill was coming together. I do think it's time to let the American people see what's going on.
Okay, see, other John Boehner, you going to let him get away with that? Are you? Get him! Get him!
What do you make of the fact that it's televised? American people are probably delighted that we're getting this televised.
I think that's fine, but, you know, is this a political event or is this going to be a real conversation?
Well, except that we've been hammering them about the transparency. The president said, you know, he's going to put everything on C-SPAN, so we can't criticize him now for when he finally does put it on C-SPAN.
But I want to make sure that we're going to have an honest conversation.
That's fine, but John Boehner #1 is not going to like that. Speaking of John Boehner #1, John Boehner #1 has also been arguing repeatedly that Republican ideas must be included in health reform. Remember that?
Republicans have much better ideas, I think, that would take the current system and make it work better.
Okay, so many of those much better ideas are now in the current plan. The White House explaining that chapter in verse on their website right now, how Republican ideas are in the plan. John Boehner, number one, you've got what you want. You've got the Republican ideas in the plan, which means other John Boehner, go get him. Go, go, go.
I would hope that the president would heed our call. Let's scrap the bill.
Let's scrap the bill. That other guy got what he wanted. I hate that guy. One thing is clear here. John Boehner is totally unafraid of taking himself on. And in the process, he's winning. And he's losing, depending on which John Boehner you're talking about. At the big White House bipartisan health care summit on Thursday, which John Boehner is expected to attend, we're all left wondering, which John Boehner should we expect? Will it be John Boehner number one, or will it be other John Boehner? I am starting to worry that a John Boehner divided against itself cannot stand. Joining us now is Democratic Congressman Anthony Weiner of New York. Congressman Weiner, thank you very much for joining us tonight. Much appreciated.
It's my pleasure. I understand they've reserved 4 different seats for John Boehner at the health care conference. I'm looking forward to that.
Because each John Boehner that might show up has 2 faces, and each of those faces needs an extra seat.
Well, they do need someone to go to the last page and tell us what the page number is on whatever they're considering. We do need someone to tell us how many pages there are in it.
And whether that means it's a good idea or a bad idea,
right.
Depending on the font size. Do you have any optimism at all about what's going to happen on Thursday?
No, because it's been kind of like debating with Sybil when we sit down with the Republicans, and you've shown it here this evening to some degree. Look, the president wants bipartisanship. I just have to say to him, good luck with that. I don't think it's going to be coming out of that room. It kind of makes you wonder who it is we're really negotiating with and whether or not, we were elected, frankly, to do health care. The Republicans believe it in their bones. They were elected to stop the president from achieving anything. Those seem to be incompatible imperatives. So I think, it'll be nice to turn the bright lights up on the fact that the Republicans don't really have substantive ideas on trying to solve this problem, but I don't believe it's going to get us any closer to a resolution or get us a single one of their votes.
Well, in terms of the state of the negotiations, though, I know that you wrote a letter to President Obama today about the absence of anybody advocating at this summit for a single-payer program, a Medicare for all program like you're in support of. Do you think the White House is conceding too much by framing the debate the way that they have been?
Well, look, the president has his proposal, and I'm glad that he's in. I've been on with you a dozen times saying I needed the president to be more of a leader than this and less than kind of just following the legislative back and forth. But let's make no mistake about it. When the president stood up and said, if you have good ideas, I want to hear them, well, those of us who believe in a single-payer system, expanding Medicare to more Americans, simple, concise, fewer pages than John Boehner is probably used to seeing, that's not going to be probably considered tomorrow. My beef with the president is this, is it looks like in his proposal he made some concessions. But concessions to whom? Who is he getting any votes from in exchange for dropping the public option, using a state-by-state exchange rather than the national exchange, not having an employer mandate? Who are those concessions intended to win over? Because he's going to find out at this summit it's not going to get you a single Republican vote.
On the public option issue, today the Democratic House Majority Leader Steny Hoyer said about the fact that the public option is not in the president's 11-page plan. Steny Hoyer said, quote, I think that it is obviously an item that the president has decided is not something that perhaps the Senate can buy. I understand that you had a very negative reaction to those comments from Steny Hoyer today.
Well, look, I think that Steny is a great leader, and he's my majority leader, and I'm going to follow him. But in this case, I think he needs more to make it clear that we should still fight for what the House bill was. I know he was just commenting on what he thought might or might not go on in the Senate, but too much of this debate is us triangulating against ourselves. Harry Reid is the majority leader. He supports a public option. A growing chorus, and I think 51 senators support a public option. The American people support a public option, and the President of the United States says that he supports it. So why isn't it in our plan? That's a mystery to me that I really can't quite figure out right now, because I can't find out who we gave that up to that got us even a single vote.
On the issue of what's in the House bill versus what's in the Senate bill, one of the ways that the House bill was able to pass, and it passed by only 5 votes, was by allowing very anti-abortion members of Congress and the Democratic caucus to put forward incredibly strict anti-abortion language, the Stupak Amendment. Bart Stupak today, we're going to be talking about this in a moment in some more detail, reiterating how much he wants to use health reform as a vehicle to essentially ban abortion, to make abortion something that you can't get covered can't get insurance coverage for in this country anymore. Any feelings on how crucial he is to these negotiations?
Look, Bart Stupak represents an important number of votes in the House of Representatives and the Senate. But we have to stop letting this process be held up by one special interest followed another. You know, we have been spending too much time. Think of the months we lost waiting for that gang of 4, gang of 6 in the Senate to come up with a bill. It got us nothing. We waited and waited for Olympia Snowe to tell us what she wanted. It got us nothing. We watched as Joe Lieberman did somersaults trying to debate himself. That got us nothing. And this is another chapter in the same sad story. We need real leadership from the president. We Democrats have to show that we can govern. There's a time to do this abortion debate. It isn't now, and I hope Bart Stupak and his supporters understand that.
Democratic Congressman Anthony Weiner of New York, thank you very much for your time tonight, sir. Much appreciated.